Welcome. In this video, we'll delve into tuberculosis-related optic neuropathy, a rare but serious eye condition linked to tuberculosis infection. We'll explore its causes, how it affects the eye, how it's diagnosed and treated, and what you need to know about this complex disease. Tuberculosis-related optic neuropathy, or TB optic neuropathy, occurs when the optic nerve, the crucial pathway carrying visual information from the eye to the brain, is damaged due to a tuberculosis infection. While it's rare for the tuberculosis bacteria itself to directly infect the optic nerve, the more common cause is an indirect inflammatory response or a delayed hypersensitivity reaction triggered by the TB infection elsewhere in the body. This systemic inflammation targets the optic nerve, leading to its dysfunction. Risk factors mirror those for general tuberculosis infection, including weakened immune systems, close contact with individuals with active TB, and living in or traveling to areas with high TB prevalence. The pathophysiology of TB optic neuropathy isn't fully understood, but it's believed to involve a complex interplay of immune responses. The tuberculosis infection, often located in the lungs or other parts of the body, stimulates the immune system. This activation can lead to the release of inflammatory mediators, such as cytokines and chemokines. These mediators travel through the bloodstream and can cross the blood-brain barrier, affecting the optic nerve. The inflammation damages the nerve fibers, disrupting the transmission of visual signals. Additionally, the inflammatory response can cause demyelination, the loss of the protective myelin sheath around nerve fibers, further hindering nerve function. In some cases, the formation of tuberculomas, which are masses of granulomatous tissue caused by TB, can directly compress the optic nerve, leading to vision loss. TB optic neuropathy is a relatively uncommon manifestation of tuberculosis, making precise epidemiological data challenging to obtain. Its prevalence mirrors that of tuberculosis itself, meaning it's more frequently observed in regions with higher rates of TB infection, such as parts of Asia, Africa, and Eastern Europe. Individuals with compromised immune systems, including those with HIV, diabetes, or undergoing immunosuppressive therapy, are at increased risk. Accurate statistics are further complicated by the difficulty in definitive linking optic neuropathy to a TB infection, especially when the infection is latent or occurs elsewhere in the body. The signs and symptoms of TB optic neuropathy can vary depending on the severity and location of the nerve damage. The most common symptom is a gradual, painless loss of vision, typically affecting one eye more than the other. Individuals may experience blurred vision, decreased color perception, and difficulty seeing in low-light conditions. Some patients report experiencing visual field defects, such as blind spots or a narrowing of peripheral vision. Pain behind the eye, particularly with eye movement, is sometimes reported. It's crucial to seek immediate medical attention if you experience any sudden or unexplained changes in your vision, particularly if you have a history of tuberculosis exposure or symptoms suggestive of a TB infection. Diagnosing TB optic neuropathy can be challenging as it requires ruling out other potential causes of optic nerve damage. A comprehensive eye examination including visual acuity testing, color vision assessment, and visual field testing is essential. Examination of the optic nerve head with ophthalmoscopy may reveal swelling or pallor. Neuroimaging, such as MRI of the brain and orbits, is crucial to exclude other conditions like tumors or compression of the optic nerve. Blood tests are performed to screen for tuberculosis infection, including a tuberculin skin test, a TST, or interferon gamma release assay (IGR). Chest rays or CT scans of the chest are often ordered to assess for pulmonary tuberculosis. In some cases, a lumbar puncture may be performed to analyze the cerebrospinal fluid for evidence of TB infection or inflammation. Ultimately, the diagnosis relies on a combination of clinical findings, imaging results, and laboratory tests, along with a high index of suspicion in individuals at risk for tuberculosis. While TB optic neuropathy isn't formally classified into distinct types, it's important to distinguish between cases where the optic nerve damage is directly due to a tuberculoma compressing the nerve, versus cases where the damage is caused by an indirect inflammatory or immune-mediated process. This distinction can influence treatment strategies, particularly the decision to surgically remove a tuberculoma. The primary goal of treatment is to eradicate the tuberculosis infection and reduce the inflammation affecting the optic nerve. Anti-tuberculosis medications, such as isoniazid, rifampin, pyrazinamide, and ethambutol, are the cornerstone of therapy and are typically administered for at least 6 to 9 months. Corticosteroids, such as prednisone, are often prescribed to reduce inflammation and swelling around the optic nerve. The timing and dosage of corticosteroids are carefully considered, as they can have potential side effects and may interfere with the body's ability to fight the TB infection. In cases where a tuberculoma is compressing the optic nerve, surgical removal may be necessary to relieve the pressure. Regular monitoring of vision and optic nerve function is essential throughout treatment to assess response and detect any potential complications. It is essential to consult and comply with your doctor's instructions for complete treatment and guidance. Preventing TB optic neuropathy relies on preventing tuberculosis infection in the first place. This includes vaccination with the BCG vaccine, particularly in high-risk populations. Early detection and treatment of active tuberculosis cases is crucial to prevent the spread of the disease. Individuals with known TB exposure should undergo screening and preventive therapy if indicated. Maintaining a healthy immune system through proper nutrition, regular exercise, and avoiding smoking can also help reduce the risk of TB infection and its complications. The prognosis for TB optic neuropathy varies depending on the severity of the optic nerve damage and the promptness of treatment. Some individuals may experience significant improvement in vision with treatment, while others may have persistent visual impairment. Early diagnosis and treatment are crucial to maximizing the chances of visual recovery. Recent research has focused on identifying biomarkers that can help predict treatment response and developing more targeted therapies to reduce inflammation and protect the optic nerve. Further research is needed to better understand the complex immune mechanisms involved in TB optic neuropathy and to develop more effective strategies for prevention and treatment.